Community Culture Unveiled, uncovering and discussing the secrets of mental health in oppressed communities. Hosted by a girl for all girls. Welcome to Community Culture Unveiled, where we're discussing the secrets of mental health in oppressed communities, along with so many other topics. And I want to introduce my wonderful co-host today, Dr. Monique Muhammad out of Jersey, Dr. Christopher Howard out of Chicago, and lovely Kaida Flowers out of Philly, East Coast. And I am Teresa. I'm here in Chicago by way of Los Angeles, California. I want to go ahead and jump in today's show because it is a packed one. It's controversial. It's very fitting of the time. And as we mentioned last time, today's show would be talking about trauma, discussing trauma within ourselves, trauma within our communities, and trauma within the world as we know the current events as they are today, the impact of traumatic events on every community then trickles down to others. So we just want to kind of start off with defining some key points about trauma. So I'm going to try to read verbatim on some things just because I don't really want to mess up some of the definitions, because for some of us, we live in a world of trauma. We live in a daily mental state of traumatic responses, and we don't even know it. So let's just go ahead and start breaking this down. Trauma is a term used to describe the challenging emotional consequences that living through a distressing event can have for an individual. Traumatic events can be difficult to define, of course, because the same event may be more traumatic for some people than others. So, for example, maybe living in a certain poverty-stricken neighborhood may affect one person differently than it affects another person, therefore developing certain behaviors which are traumatic responses to these sort of poverty events, right? And so maybe you see a bombing in a community and that's going to affect everyone differently. Also, it's based on and mixed in with your previous experiences, your coping skills, and etc. However, today's show is more to just introduce you to the topic of trauma and trauma responses, stressful events. The DSM-5 discusses trauma as an actual or threatened death. It means trauma requires an actual or threatened death, serious injury, or sexual violence. Stressful events not involving an immediate threat to life or physical injury, such as psychosocial stressors, divorce, job loss, etc., are not considered trauma in its definition. So based on your school of thought, it may be tweaked a little bit, but we all know in general, we can agree on certain mass traumas and how that really creates some havoc in your mind, in our communities, and in our world. So we're going to go ahead and jump into the show because we got a lot to introduce to you.
Okay, so as you're talking about kind of framing the idea of trauma, I'm thinking about how the literature kind of handles, when you look at statistics around trauma, often you'll see more statistics that pertain to PTSD and how, fitting that definition that you described about threatened threatened death or actual death, indirect or direct. So when it comes to trauma, when we're looking at trauma prevalence rates, generally the numbers that you're seeing are about 6% for men and 12% for women. That women report higher rates of PTSD. But then when you broaden it, right, when you're looking at, you also refer to trauma as psychosocial stressors, right? So when you look at it from that vantage point, you see the statistics get a lot higher, which is a more broad way of understanding trauma. And we'll probably drill down into these ways of framing trauma as we go along. But when you're looking at that, you're talking often about like what the ACE study, if anyone has heard of the ACE study, the Adverse Childhood Experiences study, was pretty much a landmark study that was done in the 90s. And that showed that about 45 or 50%, just under 50% of the population had experienced one early experience of adversity. And then from there, 18% have experienced multiple experiences of adversity at early childhood, which actually sets you up for later physical and psychological impairment as you go down the line. So I would even say, and we will talk about it more, that those actual numbers, when you include other factors like racial factors and other environmental uh, experiences of trauma, that the numbers are even higher than that. So just want to kind of throw that out as a base to kind
Sure.
of jump off point for us to think about.
Absolutely. Absolutely. And um, because our show is called Community Culture Unveiled, I'm going to focus a lot on your community. What does your community look like? And what does trauma look like in your community? And how can you make a difference? Of course, it starts with yourself, and we'll talk about proper interventions later on in the show about what you can do to make a change. The causes of community trauma vary. However, research suggests that it's typically rooted in social injustices such as racism, poverty, oppression, the eraser I read, and not even, I usually say the takeaway or the robbery, but they said the eraser of your culture.
Mm.
How that traumatically impacts you when you erase culture out of a community and you input a new culture into that community that produces savage behaviors. What does that look like, right? So this is so deep because it also leads to why our world is changing and why the climate of things that are happening in our communities are so volatile, right?
Mhm, mhm.
So I'm really excited to have Dr. Chris on the show today because I really thought that your perspective would be very well, not just from a psychologist's point of view, but more so from a Black male living in the Midwest and living in one of the most crime infested cities in America, Chicago.
Yeah, well, first and foremost, thank you for having me. Just a little bit about myself. Dr. Chris Howard. I'm a neuropsychologist, and I live in Chicago, as has been mentioned before. But a place where I kind of cut my teeth is just like a lot of community outreach, community work. So not only do I look at brain behavior relationships, but also look at how brain behavior relationships are impacted by the community. I think it's kind of interesting because when we talk about trauma, I think a lot of way that people look at it is like this one big approach where one bad thing happened and there's a residual
Mhm.
impact. But another way to look at trauma is like the chronicity of it. Like, so when I work with my patients, one of the things I do is ask them if they have chronic stressors. So stressors, trauma, it can almost be synonymous. But one of the things about having a chronic stressor is like it's almost inescapable. And sometimes people become so accustomed to it that they don't necessarily recognize it. So what does
There you go.
a chronic stressor look like? It could be disenfranchisement, right? So, or it could be food poverty, or like living in a food desert, or a mental health desert, or anything of the sort. But it's not so much as that, but it's like, what is the residual income of that? Like, if I'm living in an area that lacks resources, what does that look like? And I think that's kind of interesting.
Absolutely, because community trauma disproportionately impacts minority communities as they are more likely to be impacted by violence, historical discrimination, oppression, and poverty. And on the previous show, we talked about living in fear of like my lights being turned off or not being able to pay your bills. And so overexposure to poverty, what does that look like as it affects communities and how we respond? Right. And I know, Kaida, you have a master's in community mental health and in counseling, and you're in Philly, which by no stretch of imagination is a city that has not seen its diverse issues on this topic. What are some of the things that you're sort of noticing there as you did your studies and you navigate as a single Black woman with a Black son, which I know you have?
hmm Well, living in Philadelphia, I work as a mental health counselor, and I work with school age children. And in Philadelphia, according to statistics in 2019, there are 37 percentage of the children in Philadelphia live in poverty. And that's it really reflects the aggression and the anxiety that I see on a daily basis with my clients that I serve. And I also see firsthand parents, single parents, struggling and surviving, just basically surviving, and as Dr. Howard said, we're currently living in a state where a lot of people are basically surviving, so it's like you're being reintroduced to that trauma over and over again every day, struggling, trying to figure out what bills you're going to pay and how you're going to manage to the following week, to put food on the table, provide for your family, and all the other things that you may want to do. So, trauma is very impactful on the children of Philadelphia and the community that I serve.
So, as I'm thinking, like, people are saying, like, oh, I have a lot of trauma. Maybe people are thinking, what does it look like for me? And as Dr. Howard said, most people are in denial or not aware of the things that have impacted them. And when we look at our childhood, the more formative years of our brain, right? And Dr. Howard, you can speak to that about the impact of trauma from ages 0 to 6 or 0 to 12, and our formative sort of time frame has a more lasting impact on you for a longer period of time for the rest of your life. And for most of my patients that I'm in private practice, most of the root issues that I'm dealing with are things that happen between 0 to about 12 years old that are normally impacted by either their environment or their family, and most of all, their parents who have endured much trauma and passing trauma down. So it can be sort of this layer, this pass on if we don't break the cycle, right? And so some of the emotional and psychological responses may be denial, anger, fear, sadness, shame, confusion, anxiety, depression, numbness, guilt, hopelessness.
Mm-hmm.
You having a lot of those combination of symptoms that plague you every day, you have to take a stop and look at that. You can't just exist in a world where you're having all these symptoms that are negative. But go ahead.
I think that sometimes that comes to a place where people come to a place where they feel like that's normal because, as you pointed out, your environment and trauma. A lot of times, we as an African American community, we have a collective trauma, that we are dealing with.
Mm-hmm.
It's collective. So if everyone around me is dealing with the same behaviors, I feel like that's normal. And I don't think enough people are having the conversations like, hey, this is not normal.
This is not cool.
This is not, yeah, exactly. This is not, no, I feel really stuck in my life. Why am I feeling like this? Like you really have to begin to soul search and to do the work, in order to move, begin the process of healing. And maybe I'm speaking too far ahead because, now I'm talking about interventions, but, you understand what I'm saying, like in terms of just the fact that it's collective, and we begin to normalize these feelings that we're having and how we are expressing our trauma. We normalize the violence. We normalize the anxiety and the depression. And we think it's kind of like a joke. Because even on social media, we see all of these reels about depression and anxiety, all this. And we've really just normalized it when we really need to focus on healing.
Yeah, I think it's so interesting though, right? Because sometimes I feel like trauma is like this ghost, like we recognize it, but then we try to like say, okay, well, how does it manifest itself in our everyday? And I think one of the biggest ways to look at to see if trauma is being impactful is look at a community's health, right? Like when you see that Black women have a higher rate of like breast cancer, triple negative, which tends to be like a little bit more aggressive. Comes from like a different genetic set that other individuals don't have, or you think about the onset of Alzheimer's and dementia and how we have like a mixed pathology and disposition to a white counterparts and stuff, or you see that African American men like have the least lifespan, or that you look at African American women, 49% over the age of 20 has some varying form of cardiovascular disease. African American men, 44%. over 20 has some varying form of cardiovascular disease, the question becomes why. It's not so much the what, like, because the what is like, yes, we recognize this happens, but it becomes the why. And like when we approach trauma, it's important to look at the constellation of things that impact it, right? So before I address it, I have to look at what is the genesis of trauma, right? So I think one of the biggest things that's sometimes overlooked is how do we vocalize what we're experiencing? Like not only from a community aspect, do we like tend to keep things in house, but how do I express like that I'm angry, right? Because angry is like the on top of the hierarchy of emotions of being upset, but there's other things that are in the process though, right? So if I can articulate what I'm feeling, how do I like ask for help? Right. So a way that you can look at it is like if you think about a toddler sitting in a chair and he spills his cookies or his teddy bear, whatever the case may be on the floor, and he can express to his parents or caregiver or whomever that he wants his cookie back, right? So what does he do? He throws a tantrum, and as a result of throwing a tantrum, he becomes in more punishment and just a position of saying, "Hey, you know what? I want my cookies, or I want more cookies, or whatever the case may be." Right. So we look at our community and stuff, and then when you look at the disenfranchisement and you look at the divestment where they take businesses away or they close down like majority of the mental health facilities on Chicago's west and south side, then you say, oh, okay, well, these kids are out of control. Sometimes we put the onus on the kids rather than the government or the governing body and saying, okay, well, you close these mental health resources, then you shut down all these schools, but you didn't put anything back in the community. So now it's kind of like the Hunger Games or Lord of the Flies. So it's like, how do we get to a point where we address this, right? And I think that's the biggest thing. And I know we talked about like what parents feel when it comes to kids, but what that reflects is epigenetics. But I'm not going to turn this into a biology lesson. So, but yeah, just long story short, is like epigenetics is real and like something that impacted grandma impacts mom and impacts daughter. And we see it, right? When we see girls who are 12 years old, but they look like they're 16 or 22 years old, well, that's because it's an increase of estrogen. What happens with estrogen is that that's a residual effect of chronic stress, right? And what ends up
Mhm.
happening is that it's called estrogen dominance, where women tend to have a bigger chest, a bigger backside, tend to grow faster, but they live in such a society where they're over sexualized, right? So now, because it's not so much the trauma that maybe was faced at home or maybe whomever was substance abuser, whatever the case might be, but now that she's coming into her own and now she's being sexualized by people in the neighborhood or the people at school, and she doesn't
That's
have people
true.
to talk, right? So that's the residual impact, right? So it's like saying, okay, looking at the etiology, like where does this start? Like if I can nitpick where it starts, then perhaps I could do something a little bit better about it.
Sure, sure, sure. Where
So
does
I
that
would,
resonate to you, Dr. Monique, about I saw your mind going over there, so I know you got something very, very strategic to say.
I don't know how strategic it is, but I mean, I had a lot of thoughts in listening to Kaida and Dr. Christopher as well. One of the things, well, I'm just to back up a little bit, Dr. Christopher, you were talking about some of the physical health problems that kind of flow from trauma. And I'm glad that you brought that up because often we think about trauma, we just think about it from a psychological perspective, and just the emotional ramifications, the denial, I think was mentioned, and, the sleep disturbance and all these other types of things that happen kind of more on emotional psychological level, but there's also the physical health impact, right, that you talked about. There's as well the cognitive impact. And what we need to, it's important to understand that when you see a young person in school and they are having difficulty concentrating, that they're sometimes their decision making skills are really, really poor, or poor memory. These types of things are also signs of having experiencing chronic traumas. Also, we understand that when people experience chronic trauma, that there are structures in the brain that actually atrophy as well, right? The hippocampus and the amygdala, which are invoked in trauma responses, when that's triggered chronically, they tend to atrophy, and that creates other cognitive impairment as well. And so you have kind of that cognitive kind of cluster of experiences, and then of course what flows from that is behavior. And that's something common. So sometimes when we think we're looking at behavior, we're thinking we're looking at willful behavior and the young person just being bad, or even an adult for that matter, right? They're just being bad, they're being defiant. But really, a lot of times what you're really looking at is trauma when these young people, they have poor impulse control, or they display a lot of risky behaviors, or as soon as something happens, they shut down, or they get explosive, right? One way or another, or substance abuse. Like all of these things are also potentially, not always, but they're potentially signs of that we might be looking at somebody who has experienced serious trauma. So I think,
And Dr. Muhammad, I wanted to mention something like, from what I see, because in Philadelphia, I'm a master's level clinician. And when I go into the evaluations with my clients, it seems as if doctors do not want to give, they want to give the ADHD and the explosive disorder instead of labeling it as what it is in terms of trauma, and that's how I see it. I see it, the trauma response from the environment that they live in. And and it really, I'm always thinking about that, like why they're not giving more children the trauma diagnosis, as
yeah.
opposed to just labeling them ADHD, or oppositional or other things, where it's clear that they come from a background where they deal with a lot of trauma.
All right, so
Dr.
just real
Christopher, I want to jump in there too. Go ahead.
Um, so I'm gonna approach both questions though, but what Dr. Monique was saying was kind of interesting. Just in effect, what we're kind of looking at is the compound, right? So it's like you already have a bad situation, but you're making it work. This is when like the social environmental plays a role, because it's like, okay, if I'm in an underserved community and stuff, then it's like my brain doesn't fully develop until I'm 25 years of age. Okay, so that's something I just can't control. That's going to be what's going to be. But then I go to a school or I'm in an environment where I don't get a chance to eat breakfast, right? Because I mean, food is basically gasoline, basically it's fuel and stuff like that. So if I don't have a chance to eat something properly, maybe I have half a bag of hot Cheetos and maybe a juicy juice or quart of water, whatever the case may be and stuff. But that's not enough sustenance that's going to carry me at least to lunch. So what ends up happening, have you ever been hungry? It's hard to focus. Like you can't read, things don't make sense. You can't feel everything of the sort, right? So what's end up happening is that you're compounding a situation. And just with the brain, right? So what ends up happening is that with your frontal lobe, this is where your thinking, organizational skills, your personality, everything of the sort, but it's divided into two pieces. You got your dorsolateral prefrontal cortex and you got your ventromedial prefrontal cortex, right? So when everything's fine and dandy, your prefrontal cortex is hyperactive, or that just means that it's functioning and stuff. So that way you have a level of social compartmentalization. But when you're stressed, your ventromedial prefrontal cortex becomes a little bit more active, and that's more your fight or flight, right? So if that's active, then somebody confronts you with a situation, then you're more prone to act out, right? So it's all neuroanatomy more so than some sort of existential willful decision. So that's what ends up happening. And just with your ventromedial prefrontal cortex, it goes into your anterior cingulate cortex, and it goes into your hippocampi and your
Got it.
amygdala, all stuff that goes into emotions, decision making. So that's why people are more prone to act out. And to your point about just the medications and stuff, a lot of times the physicians aren't people of color, so they're more prone to say, hey, you know what, let me just diagnose them with attention deficit hyperactivity disorder, because what they're doing is that they're looking at symptoms and not the etiology of the program, like what is causing this. As a people of
Mhm.
color, with respect to mental health, like it's incumbent on us to kind of look at the etiology, because if we recognize what um, stimulates the ventromedial prefrontal cortex, then in juxtaposition to like some coarse punishment, kicking them out, putting them in detention where they're not engaged. If you engage with these kids and you can lower that level of stress that they're experiencing in that moment, then what's going to end up happening is that the bad behavior is going to dissipate and better behavior is going to come, right?
Sure.
But it takes somebody that can be able to speak to children. This is why culture matters. This is why diversity matters. It's always important to
Yes, it
remember that
does.
the difference between inclusion and diversity, right?
So
Okay. I
go
got
ahead.
you.
You wanted to jump in.
Just in case anybody got lost, the audience got lost with Dr. Christopher's um, information, because it was a lot to take in that one breath. I think maybe give us the more layman's or simple sort of point that you're making from all of that, which is what?
It's when you're stressed, your brain just operates differently. So finding a way to quickly get your brain to operate is incumbent on like or leads to better behavior, right?
Sure.
So this is the breathing exercises come in. This is where it comes in, and like being able to talk to somebody in a soft voice. Whatever, just to disabuse that level of stress that somebody's going through in the moment, because a lot of times it's a lot of things that somebody's dealing with at once. Not only is it just a maturing brain, but if at home the only way that they know how to deal with conflict is with more conflict, well, guess what they're going to do when they get outside of the home is that they're going to approach every conflictual situation with more conflict, and perhaps that works in their home or in their community, but their closer community. But the moment that they get away from that, that's no longer advantageous, and rather it's quite the opposite.
Sure,
Hopefully that.
sure. Got you.
So
So go ahead, Dr. Monique.
yeah, so I just, in adding on, like the trauma, it as Dr. Christopher is explaining, it's cyclical and it's compounding, right? So then you're experiencing things in a certain way that's creating some sort of impact, and then you're responding to life. Um, and those situations kind of tend to continue to exacerbate the already symptoms that you're experiencing. But I thought Kaida brought up a really good question about why we tend um, to overlook, right? To not pay attention to the environmental factors, right? I think that's so true that we just look at the what, we don't look at the why. We're seeing behavior, and we're like, as clinicians, we're also trained to see behavior, right? Check, check, check. These are the things that I'm seeing. This is the diagnosis that you apply, and that's it. But what we have, what we, I guess, coming to the understanding, unfortunately, in our field, but I think we're still a little behind the eight ball, particularly when it comes to Black youth, is that there are environmental factors that create the behaviors that we're seeing. So the behaviors don't come out of a vacuum. And that's really important for us to understand. Dr. Christopher mentioned epigenetics. And for those that may not understand epigenetics, basically that's that transfer, if you will, of trauma from generation to generation, right? The idea that I can experience severe trauma and have a child, and that child will be born with a vulnerability, if you will, right?
To that issue that you're dealing with.
To
So
the
if you're
issue
dealing
of
with
trauma.
domestic violence at the time you're pregnant, that domestic violence and what you hear and what you absorb can be absorbed into the womb. And that's why it's very important to protect and nurture that thing that you're growing inside of you, so that you don't keep transferring these genetic things to children. That's more of in the layman's way of saying, and I know I kind of cut you off. I wanted to sort of give this more personal testimony, because I know we're intelligent people. Thank God that we reflect some level of intelligence, that we fought the odds and we made it. And despite what maybe some other communities think, our brain works, and it works very well. And I'm very proud of all of you for what you're contributing today. And I'm also proud, I want to say, forgiving yourself at some point, for the things that maybe you didn't have control of, and also the things that you've sort of perpetuated as a result of what you've experienced. And I say that leading to a point of even forgiving myself for my environmental traumas that happened to me, and how long it took me to get myself out of some of those things. So just recognizing them in myself. I often do this with my patients, which is not always recommended in therapy, to expose and be transparent. But I realized doing therapy for Blacks and Browns, because my dad's side is from Mexico, so I deal with a lot of Latinos. We all have the same issue, which is trust. And when someone feels that you haven't struggled and went through the same type of experiences that they've been, and you're going to sit with them and talk to them about how to change their experiences, it can be very difficult if you don't connect on the trauma level. Right.
Yes.
And so oftentimes I will tell certain stories to sort of see if they can find themselves in the story. But I already know they exist in my story, because I'm already talking to them about it. So I tell the story so they can connect. Right. And one of my stories about trauma is being left at home alone at a young age. As my mother and father were criminals, and they were in and out of prison. And I grew up in the 70s and the 80s and some of the 90s. And so, the cocaine epidemic and partying in the 70s and the 80s was real. And as a result, I was left alone a lot at 4 and 5 years old, to a point where I was just very scared. And I remember mentioning this before on a intro show, that after being left at home alone so many times, as I got older, I started to notice I was very fearful of being in the house. And then you have these behaviors that don't really make sense because I'm a fighter. I'll go to the hood. I'm not a scary person. So why is it that I'm scared in my house? And I mentioned this before, but I think it's very relevant to what's called self-identifying your own trauma within first, right? And you want to know why you're not functioning in relationships properly, or why you're making your children live in your trauma because you're living in a fear of something. Now you're telling them to live in that same fear. So I knew I had to get rid of that. I was like checking under the bed, checking closets. I couldn't go to sleep at night without checking the whole house 2 or 3 times. Now it looks like OCD, but now you have another condition born out of trauma, right? So now it looks like, oh, she's got OCD, but it wasn't. It was my fear of being in the house alone, which absolutely made no sense at all. And I mean, to a point where it was causing me not to sleep. And so my definition that I want to throw out there for people so they can be more clear in a more basic way is that when something impedes on your ability to function, to sleep, to eat, to have relationships, to get along with people, to develop friends, you have to start looking at, as you said, Dr. Chris, the root causes of what led you down that road. What experiences have you had that would stop you from doing certain things? I mean, it was insane, the amount of trauma I had with staying at home alone. Thank God what I did is exposure therapy, and I kept exposing myself to the same experience over and over again until I stopped checking the closets and under the bed and around and all these other things. But these are just simple examples of what may be going on in your life. If you're watching this show about trauma, that maybe you're sort of juggling with. And there's so many others that I know you all can jump in and sort of, maybe if you have your own experiences or things like that. And this is the experience part of the show, because we all have been affected by something on a larger level that sort of, as we all talked about today, trickled down. Because I was that child who came to school and was hungry and my mother was in prison, and the trauma of finding all the cereal boxes that I like and stacking them and hoarding them so that I can have enough breakfast to eat. I remember what that felt like. And I remember my mother being in prison and not being able to focus at school, failing, but I was a smart child. But when she got out of prison, it was, I aced everything. And that's when I looked back and I knew that those type of circumstances affect children's ability, and they are clueless why their behavior is even what it is. So I just wanted to testify more in a more personal way to what all of you all were saying. And I didn't mean to take up so much time doing that, but I just felt compelled because I felt like the story matched the intellectual component of what you were saying.
Well, my experience, living with a parent who was very critical, a lot of criticism, growing up, I had to really, how can I put this? It was like my thoughts, cognitive distortion. I dealt with that a lot growing up, a lot of negative thinking. And one day I just had to sit back and ask myself, where did I get this from? Well, what happened? And when did this start? Because it did have a beginning point, and I had to realize, I had to pinpoint, where it came from. I grew up, I was the youngest, and I just dealt with a lot of criticism and a lot of just negative talk. And they say that, when you're dealing with criticism and you're dealing with negative, talk around you, that's going to be your inner voice. So my inner voice was very negative, and so it took a lot of, it still takes a lot of work to revamp those thoughts, and using positive self-talk, positive affirmations helped me and is helping me to, work through some of those cognitive distortions, that I've dealt with and that I still deal with till today, and that's trauma. That's that childhood trauma. And it took a while for me to understand where it came from and what I needed to do in order to begin to heal myself so that I can move forward and have a healthier life. So it's just, it's deep. And my thing is that, how do we reach the community? how do we spread the word? I know that this platform is an important piece, you know, but it's so important that we, you know, deal with a movement of radical healing, you know, in order to uh, help others with their trauma, you know.
Right.
Absolutely.
You know, what's so interesting. Like a lot of times, what we look at is called categorical fallacy. So, categorical fallacy is like it looks like one thing, but it's something completely different. Like, for instance, it might be like depression, right? Where you might diagnose a kid with ADHD, or you think that there's something going on with me, or whatever the case may be. But then when you do like neuropsych testing, like all your attentional skills are where they're supposed to be. But really, what it is like it's depression, but it manifests itself differently. It's an atypical
Hmm.
presentation. And I think that's kind of interesting, though, right? Because like when you go through the trauma, like I kind of mentioned a little bit earlier, it's like, okay, well, what ancillary resources do you have available that can help you navigate through this trauma, right? Because even though we've been successful managing the trauma that we've endured in some form of fashion, whatever part of our lives, there's other people who endured the same trauma, but they didn't make it to this level and stuff because perhaps they didn't have the same level of resources. Granted, there's things that are innate, like cognitive reserves help you get to the next level. Case, but maybe not everybody's fortunate to have those things. It's just one of those things where, okay, somebody's very critical of me, but nobody never really disabuses that notion of like my shortcomings. So now the way that I see the world is that everybody's critical of me, and as a result, I don't take those initiative. I don't take those steps. So it's just one of those things where, or that's in trouble, in jail, whatever the case may be, and we don't have anybody that kind of helps us cope or get over that stuff. So as a result, we just mad at the world, or we can't focus. So it turns from I could go to any hood and I'm comfortable to anytime I see somebody that's different of me because I'm uncomfortable, I gotta fight back. I gotta buck back, or I gotta be the toughest person there. And that's the type of thing that makes it very troublesome.
Got it. So where are we at with, we went around the world and came back with our trauma, trauma in communities, trauma within ourselves, trauma on a larger scale when we talk about current events right now and how we're responding to other people's trauma. I said to someone the other day, I think Blacks are, how can I put this without being offensive? And it's hard for Blacks to empathize or feel very sorry for other communities experiencing trauma because we live in trauma. So like the current events now on the table are hard to connect to because our children and our babies are dying. So how on a bigger scale, I mean, this is a real, and I'm not afraid to say it. It's like, how do I'm not really watching the news that much. I mean, I'm looking at the comments, I'm looking at the responses, but how do we, when we're so burdened with trauma, connect to other people's trauma when we living in it? It's difficult. And so we start with ourselves.
So you know, I hear you. And I think what you're talking, no apologies needed, first of all, right? Black people experience so much at so many levels, and it's so heavy that if we're not present to empathize with the traumas that other people are experiencing, that's not something that needs to be apologized for. And I just want to say that. Um, Not to say that it's a good thing, right? Because that in and of itself is as I see it, you're looking at collective trauma. That's why when one part of what the trauma experience, what trauma does, it closes you down, it shuts you down, it closes you off from other people, it separates you from other people, it takes
Mm.
away that empathy. And so when what you're seeing itself is a trauma response, and one can't hold someone responsible who has been battered and beat down, right? Who has been traumatized for not empathizing with someone else's trauma. That person needs healing. And so I just kind of just bringing some context to what you're saying, that the why, right? Not the what, but the why we might see that in Black people because of the so many levels and layers. We talked about the epigenetics that you can't even do anything about, right? That's that cellular level stuff. There's historical trauma that there's a lot that everyone's talking about. That
Can
just
we
kind of
define
follows.
epigenetics? Can we define epigenetics for our audience? Because some of us really don't know what epigenetics is, and we're throwing around words that people don't really know. I pulled it up just to be clear. Is the study of changes in organisms caused by modification of gene expression rather than alteration of the genetic code itself.
I
If
think we
we
can
were,
make it simpler than that.
yeah, I'm about to say, can we translate it to a more simple way of saying that?
And wouldn't it
There
just be
was,
trauma passed down from generation to generation?
well,
It's
I think
it's
that's
kind
just,
of
I
like
see you
how
want to
the
step in.
environment, like, I mean, basically, it's just like, how does your environment affect your genetics, and like, how does that pass on to other people? So it's just two things.
Yeah. And I think
Environment and
this could help to really, what could help to give it a little more, I think, it was more of an illustration for people who may not be familiar. There was a study that was done, I think that really kind of explains it very clearly with mice or rats, that they would present the smell of cherry blossoms and shock the mice. Present the smell of cherry blossoms, shock the mice. Eventually, basic conditioning, what ultimately ends up happening, you can present the smell of cherry blossoms and you'll get the reaction without even having a shock. That's basic conditioning. But what they found is that when that mice had pups, if you presented the smell of cherry blossoms to the pups, having never gone through that shocking, they would have a trauma reaction.
Mm-hmm.
And that, I think, helps us to understand what we're looking at. We're not even
Sure.
having the experience, but we're already at a cellular level, that response
Sure.
is embedded in us.
So holding people accountable for what they do to themselves. And as a mother, like you get two mothers on here. I didn't physically give birth to children, but how important as we wrap up this show is, and maybe we can save this for questions. We'll save this for questions, maybe, because I think this was sort of asked, which was, and we'll be to continued on this, is the importance of mother's protection of herself when giving birth and passing down trauma in an epigenetics way, and what is our duty and our responsibility as an individual to be responsible for that, and for men to be responsible for feeding that woman the right thing, so that your child, the child that you want, will you have a better likely chance of producing one that is in a different light, right? So we got to wrap up because our time is out. I know it kind of went kind of fast. We have to wrap
Yes,
up.
it did.
As we say, this is more of a general trauma. We sort of touched on and discussed trauma in communities, trauma within ourselves, and then trauma in the world and how it impacts traumatic communities, or communities more so us, affected by worldly trauma. Right. And so in our upcoming show, we're going to be discussing more specific traumas, which of course would include racism and the journey of systemic racism and how that's created the traumatic response for our communities. That is the prep for our next show for trauma part 2, but these are going to be more specific. And I think that is kind of long awaited, this systemic racism and how it impacts communities in a traumatic way on an individual, as a family, and as a community. So we hope that you tune in to our next show. But does anyone have anything else to wrap up with, just as some final notes before we close out, before we do questions and interventions? But I don't want anyone to go far, because we're going to give you interventions, which actually I think we were going to do now, right, Dr. Monique? Some quick interventions to identifying trauma within yourself and doing things to de-escalate your own trauma so that you can function in a better way. So let's go ahead and do interventions. I think that's what we're going to try to do. Sorry about that. Let's go ahead and do that. Does anyone have any comments on that, Dr. Christopher, on something very quick that people can do to de-escalate themselves, or to or whatever platform they're existing in, they can do?
Yeah, I mean, I think community is key. And I think a lot of it starts in the church. And I get the pushback, a janky pastor, or the money disappears, or whatever the case may be. But aside from the metaphysical standpoint of what the church represents, I think church also represents community. When I was preparing my dissertation, one of the things that I found is like individuals in church, they tend to live 7 years longer and they have a better quality of life, right? Because you have a level of
Mhm.
community. Because if you're isolated and you don't utilize anything, if you don't use it, you lose it. So I think not to evangelize or preach or anything like that, but I think we have to find a way to get back into having more of a community, trusting one another, depending on one another, that sort of thing. How do we aggregate
And
resources?
how to achieve that. So I'm gonna add to your spirituality. Spirituality may improve post-trauma outcomes through reduction of behavioral risk through healthy religious lifestyles, not just the
Mhm.
church, but if it's a mosque or if it's some organization that spiritually connects you to God or some higher being that gives you structure, because
Mm.
we know structure leads to better and longer life. Living
Mhm.
haphazardly puts you at a bigger risk, right? So through healthy religious lifestyles, less drinking, less smoking, expanded social support through involvement in spiritual communities, enhancement of coping skills, and helpful ways of understanding trauma. Um, Being a part of something that is guided by something higher than yourself gives you purpose, and it helps steer you away from sitting in your trauma. So just to take it even further past the church, we can even move just to more of a spiritual, and that's what I think the mindfulness was born out of, this mindfulness
Yes.
of centering yourself and finding more
Mhm.
spiritualness in yourself that's higher
Mhm.
than yourself and connecting yourself to something bigger than me, because it's me, and it's me, and it's me. And it's like, it's not you. It's like we live in a world where we exist with other people. And I think religiously, it connects you to being conscious of others versus just yourself. And I had to like add to that to try to give it some more context. Sorry.
Yeah.
Anybody else?
Yeah, I
Yeah.
wanted to say, I know, the church is very, very important, but I do believe in grassroots efforts. You
Sure.
know, I believe that it is so important that, like, even though it all ties in together because, you have the church, and a lot of times the grassroots efforts do stem from the church. It's just like under their umbrella. But, I feel like we need to have more, just support groups in the community, uh, walking groups in the community where women can come together and say, okay, we're going to walk every Saturday morning, um, and other self-help type groups, that's a grassroots
Groups.
effort, where you have people that live in the same area coming
Sure.
together, uh, working on healing themselves, self-care, healing,
Sure.
forgiveness, all of those important elements.
Absolutely. You keep saying the word groups. And I think because we have so much distrust in our community, we want to do things on our own. And it is very difficult to move and shake on your own and to overcome and to do this and to do that on your own. So what
Mhm.
I'm hearing you say is group. It's a
Yeah.
group effort. It's a group. It's binding together. It's working together. It's being cohesive. It's discussing. It's acknowledging. It's healing. So it sounds like you are well on board with the community culture unveiled.
Well,
Uncover.
that is our true essence because as African people, we exist together. You know,
That's right.
When
we
did we
don't
get broke
Right.
up?
exist as isolated and as an
That's
individual.
right.
We exist together. I am
Say that.
because we are. You
Yes,
know,
Right.
and
yes.
that's about we in order to survive, we need one another.
Right. Right. And I think I'm
That's
so glad that you raised that, Kaida, because that is sometimes it might feel antithetical to what one thinks they need when, because trauma kind of tells you to isolate, but that connect, especially for Black people, being in
yes.
community is so healing and it's so powerful. And there's so many different group
Mhm.
experiences that are coming up. And I've done a lot of group work. And people find it extraordinarily powerful. You will get so much
Yes, it
further. You
is.
get so much more bang for your buck, if you will, when you
Mhm.
work in a group effort than you do one-on-one individually. So I'm glad you brought that up along with, and it doesn't have to be everyone sitting in a circle feeling something, right? Activism, you mentioned that, right? Because
Yes,
people
yes,
don't like that. But activism, getting out there and actually applying yourself towards some sort of end that is so therapeutic as well. But I wanted to kind of add one more, I guess, facet of intervention or healing approaches, and that's stems from the recognition that trauma is in the body, right? And we probably all heard the score, the body keeps the score. That trauma, the experience of trauma is here. It's really neck down. Your body has all these stress responses that happen. It's a full body response. And because we know and we're understanding that now, there's a whole range of somatic practices that are being employed now that are very effective practices that help us to kind of ground and center ourselves, because trauma is vibrating up here. When you breathe, breath work, that can be very, very helpful. Movement is another thing that we're getting into, and it could be movement, just, dancing, but there's a whole therapy around shaking, just shaking your body, right? Like you see, there's a story about ducks that I use with my clients, but after a duck or other animals, or you see a cat, they go into something, difficult. You put water on a cat, what do? They shake. That shaking actually can be it helps to kind of ground the body and get it back to baseline. It's an parasympathetic response to kind of, I guess, ground that sympathetic stress response that we experience. Meditation, mindfulness, I think, Teresa, you already mentioned. So there's like a whole range of things that we can employ that don't look like the traditional sit knee to knee with somebody and talk about how you feel.
So I want to bring up productivity because it's one of our mentors' coping skills or solutions to however you're feeling or whatever you're experiencing, which is productivity. Getting things done, even small and relatively meaningless tasks, can help distract someone from negative emotions and apathy that are inherent in depression. So like one of the things I do is I get up when I'm feeling low and my pain is, and the trauma of this surgery and all the medications I've ever taken, all that happens. I get out of the bed, I start doing lunges and crunches, and I stop thinking about the things I can't do for myself, which maybe in my upper body is hurting or I can't do. So I was like, I'm committed to having the best lower body ever. So more so cognitive reshaping, which is sort of changing your view on it. Instead of your cup is half full, half empty, half full. It's focusing on the things you can have control over and building on that, because sometimes your issues are with someone else. And I tell people, you can't control these other people, but do the things first that you have the most control of, and then work your way to the things maybe that have a little bit more varied results in. So I'm over here in the mirror like, well, I'm gonna keep doing these lunges and and I feel better. Sometimes I mop my floor. Sometimes I clean the toilet. Sometimes I do things that says, I'm not dead. I want to live. And if you tell yourself you're dead by doing nothing all the time, because when you do nothing, you're telling your body that you don't want to live. And then your systems start to shut down and they start to weaken because you're not using critical parts of your brain that stimulate your body to move forward in life. It's very simple science. So if you want to feel better and you want an immediate result, do something productive that you've been putting off to help you feel like, oh my God, I've taken that off my plate. I've overcome that. Then you can find some centering. You can be like, okay, I feel a sense of balance because I took that off my plate and I don't have to do that anymore. And you can check it off the list. I mean, I always give my clients productivity as an intervention. And when they come back, they're so excited about what the things that they got done. And then it helps to build self-esteem. So these are just a few interventions. I know we're over time and I just sucked up the last minutes of it. But if anyone else has any more constructive interventions, we definitely can hear them. Or if not, we're going to go into questions that were pre-picked from our audience that they sent in about trauma. We're going to be answering those and then close out. So stay tuned. Okay, we are back and we're about to try to tackle a couple of these questions. We're going to try to keep them as brief and as simple and as easy to follow as possible. I know there was a lot of questions sent in, so I'm going to try to pick the most pertinent ones that I think maybe we can sort of jump in and quickly answer. Let's see. Someone anonymous wrote, how do people distinguish between behaviors in their children that stem from traumatic events versus basically over labeling our children with ADHD every time there's an issue and they can't focus? This is a good one because I have a lot to say about it, but I'm not going to try not to answer. I know Dr. Christopher probably has something to add to this, but does anyone have a return on this one? No? What? My
No.
psychologist.
Waiting.
You want to hear the question again? It's basically the over labeling of this, our children with ADHD versus whether they have, which we spoke about earlier, ADHD versus traumatic events and identifying that.
So I think it's important to note he has a really great question because there is a lot of overlap between, some of the symptoms that might be specific to ADHD that also overlap with PTSD, like concentration, poor concentration, memory, impulsive behaviors, that type of thing could be either or. But I think that the thing that I often try to encourage people to do is always, I say, rule out trauma. Put trauma in the equation first, right? From the door. It's start with kind of a hypothesis that there may be some trauma going on, and then rule that out versus working from the back way, because there are a number of diagnoses that depression can overlap with ADHD, ODD or oppositional defiant disorder can overlap. So if you look at, depending upon how the person is presented, and particularly when it comes to children, we give children to us in very segmented ways. We'll just give them a snapshot. This is the behavior that I'm seeing. And you say, oh, well, that's depression, or that's they're being defined, that's ODD, or that's ADHD. But if you don't do a full history, right? Find out what's going on in the family. Find out what's going on in the community. Find out what the experiences have been. Find out what the history has been for that family, right? When you begin to look at things from a more broad perspective, then you get a sense of being able to differentiate between, am I seeing trauma or am I seeing something else more discrete?
Sure.
Yeah.
All right.
Um,
Moving on to the next question because we're out of time. What are some signs of, let's see. What are some signs of trauma? What are some physical and emotional reactions to trauma, or some signs of trauma, such as being easily startled or frightened, always being on guard for dangers, self-destructive behaviors such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritability, angry outbursts, or unexplained aggressive behavior, overwhelming guilt or shame. Those are some of the physical and emotional reactions or signs that maybe you've experienced some trauma. Does anybody else have any that they sort of deal with?
Nightmares, night daydreams, but nightmares is definitely a big one that a lot of people who dealt with trauma, flashbacks.
Okay. Anybody
I
else?
think it's also important to remember, Dr. Christopher spoke about it earlier, and I mentioned it earlier as well. Trauma doesn't always appear from a psychological or emotional kind of symptoms. We also, poor health. If you see that young person that always has stomach aches, or is always sick a lot, right? One of the things that trauma does, it stimulates the sympathetic nervous system, which suppresses immune function. Right. And so when that is happening, then you are susceptible to illness. So if you have a young person that's always ill, or they have a lot of stomach issues, or can't sleep, that type of thing, you want to look outside of just how someone feels or how they're reacting. So you want to look at the behavior stuff. You want to look at relationally, what's going on with that person? Is there a lot of breaks between that person and other people in their circle? So these are some of the other things outside of the psychosocial stuff to look at as well.
Did anyone else have anything for that? That was good.
Yeah, that was good.
That's good.
That was real good. That was real good. Unfortunately, we are out of time. I would love to answer everyone's questions, but I want everyone to still continue to send them in because we'll still offer a platform to answer any additional questions. Of course, I'm very grateful to have such an esteemed co-host staff here and know that, it should be encouraging to everyone to know that you have Black professionals or people of color professionals out here trying to make a difference, trying to either work from the back end, studying and working with organizations, or they're out in the community working for change. I think that if you do really want to see a change in yourself and you want to see a change in your community, you have to get involved and be a part of the solution. The solution. If you're not part of the solution, then you're part of the issue that is perpetuating our constant death in our community. And that's what we want to stop. This platform was created to uncover the secrets that are killing us, either a mental death or a physical death. And we all know that our mental death leads to a physical death, which is so traumatic because we have our youth running around here without any care or dying. I call it passive suicide. Passive suicide is when you engage in activities that's like Russian roulette that could get you killed. And so our community needs help, but it starts with us and not being afraid to tackle these topics and tackle what's going on in our communities. And yes, things have made an impact on us from very long ago. And we'll be talking about that in the next show, systematic racism and how it impacts our inability to overcome. Just because two people are given this an opportunity doesn't mean they have the capacity to utilize the tools to get what they need to do, because everybody doesn't have the same understanding of what success and overcoming looks like. So we're going to look at systematic racism on the next show and delve into how that impacts us as a community in the Black and Brown, Indigenous, oppressed community. So I really look forward. Do we have any closing remarks before we go? I'm so grateful for all of you today, and I'm very thankful for today's show. Does anybody else have any closing remarks?
This was a great conversation.
I'm sorry, Dr. Christopher, you were saying something?
No, I was just saying thank you for having me.
Oh, absolutely. And you'll be coming back to join us on our future shows, correct?
Yes, I look forward to it.
Absolutely. Absolutely. And Kaida, you as well. You'll be coming back to join us on some future shows.
Of course. This dialogue is definitely needed in our community. We definitely need to start talking about, trauma and talk about how we can be impactful to our communities.
And if you didn't notice, our ticker at the bottom says join our exclusive Telegram group at CC Unveiled. Subscribe to our YouTube channel at Community Culture Unveiled. At Community Culture Unveiled, please subscribe. Please subscribe. Please subscribe. Be a subscriber so we can spread the word and we can make a difference in our community. One crumb, one step, one vision, one mind at a time. We will get there. We will definitely get there. So we'll see you next time on Community Culture Unveiled. We look forward to seeing you. Take care.
Brothers, anybody, family members, if you know anyone that needs this show and it's necessary, tell them to tune in.
Community Culture Unveiled, uncovering and discussing the secrets of mental health in oppressed communities.